Welcome to Little channel. Today we will see health and wellness first unit next concept. Local demographics, societal issues and factors affecting health and wellness. Let's see local demographic definition and importance. First one, what are local demographic? Local demographics are the characteristics of people living in a particular area, such as a town or city. These characteristics includes population size and density. It means how many people live in the area and how crowded it is. Next one is age distribution. That means the number of children, adults and elderly people. Next one is gender ratio. That means the proportions of males and females. Next one is ethnic and racial composition. That means the different cultural and racial group in the community. Next one is education level. It means the percentage of people with different level of education. Next one, employment and income levels. That means the type of jobs people have and how much they earn. Next one, religious and cultural afflictions. That means the beliefs and traditions of the community. Next one, household structure. That means the types of family. For example, single parents, nuclear families, like that. Then, why are local demographic important? Help governments and business plan resources like schools, hospital, roads, etc. Next one, influence economic growth. For example, if the community has skilled worker, companies may invest there. Next one is affect health care and education service. For example, areas with more elderly people may need more hospital. Next one, guide public health strategies. For example, if many people have poor nutrition, programs can be created to promote healthy eating. Next one, local demographics and societal issue. Different demographic factors create challenges that affect the well-being of a community. Let's look at some key societal issue. First one is economic inequality. Issues based on some people earn much more money than others, creating a gap between rich and poor. What does the impact mean? Poorer families may struggle to afford health care, education and healthy food, leading to poor health. Next one is unemployment and job availability. Issues are if there are not enough jobs, many people remains unemployed. Impacts are unemployment, increased stress, anxiety and health problem due to financial struggles. Next one is education disparities. Some issues are some people have access to high quality educations while others do not. What are the impacts means? People with lower educations may have less knowledge about health and wellness, leading to unhealthy lifestyle. Next one is a householding and homelessness. Issues are lack of affordable housing force people into overcrowded or unsafe condition. Impacts are increases the risk of diseases, stress and mental health problem. Next one is crime and safety concerns. Issues are high crime rates make neighborhoods unsafe. Impacts are fear of crime discourage people from exercising outside or socializing, affecting physical and. Next one, access to health care. Issues are some communities do not have enough doctor, hospitals or clinic. Impacts are delayed treatment can make health problems worse and increase preventable deaths. Next one is cultural and ethnic diversity. Issues are language barriers and cultural difference may make it hard for some people to access health care. Impacts are some groups may not receive proper medical care or feel discriminated against in healthcare setting. Next one is aging population. Issues are many countries have a growing number of elderly people. Impacts are more health care and elder care service are needed, increasing pressures on younger generation. Mental health and social isolation. Issues are more people are experiencing anxiety, depressions and loneliness. Impacts are Poor mental health can lead to substance abuse, suicide, and decreased productivity. Next one, environmental issues. Issues based on pollution, climate change, and lack of green spices affect public health. Impacts are increased respiratory diseases, heart problems, and limit outdoor activities. Next one, factors affecting health and wellness in local communities. Many factors influence the overall health and well-being of a community. These can be divided into social, economic, environmental, and behavioral factors. First one, social determinations of health. These are social conditions that affect people's health. Then, education and literacy. Peoples with higher education make better health choices and seek medical help when needed. In that, social determines family and community support. A strong social network improves mental health and emotional well-being. Next one, crime and violence. It is high crime rates increase stress and discourage physical activities. Next one is economic factor. That means money plays a big role in health and wellness. Income levels are wealthier people can afford healthier food, better housing, and quality health care. Employment status, having a stable job reduces financial stress. Having a stable job reduces financial stress and improves access to health care. Then healthcare affordability, or if medical care is too expensive, people may avoid getting necessary treatment. Next one is environmental factor. The environmental where people live affects their health. First one is air and water quality. Pollutions can cause lung diseases and other health issue. Next one is a housing condition. Poor housing can lead to asthma, infections, and mental stress. Access to healthy food. Some areas called food deserts have little access to fresh fruits and vegetables, leading to higher obesity rates. Next one, behavioral and lifestyle factor. People choices also impact their health. First one is physical activity. Lack of exercise leads to obesity, heart disease, and diabetes. Next one, diet and nutrition. Eating too much fast food and sugary drinks increase the risk of chronic disease. Next one is substance abuse. That means smoking, drinking, and drug use harm both physical and mental health. In conclusion part, a community demographic shapes the societal issues and health challenges its people face. By understanding these factors, government and organization can create policy and programs. It improves health and wellness. Tackling economic, environmental, and social changes can lead to a healthier and happier society. Let me recall this chapter. What are local demographic? Local demographic refers to the characteristics of a population in a specific place, like a city or town. These characteristics include a number of people living there, their ages, gender, education levels, jobs, and even family structure. Understanding these details helps in planning reduce like schools, hospitals, job opportunities. Next one, why are local demographic important? Knowing about a community demographic helps in decision making. For example, see if an area has many elderly people, more hospitals and senior care facilities may be needed. If a city has many young children, so more schools and playgrounds should be built. This information helps governments and business plan better service for everyone. Next one, how does economic inequality impact health and wellness? Economic inequality means some people have much more money and reduce than others. Poorer people may struggle to afford healthy food, proper housing, and medical care, which lead to poor health. They may also experience more stress, which affects their mental and physical well being. Next one, what is the impact of high unemployment rates on a community? When many people in a community do not have jobs, poverty increases. This can lead to stress, depressions, and health problems. Unemployed individuals may also have difficulty affording nutritious food, health care, and stable housing, making their overall health worse. Next one, how do education disparities affect health? Education plays a big role in health. People with higher education usually have better jobs, making it easier to afford health care and a healthy lifestyle. They also under health related information better, which helps them to make good choice about diet, exercise, and medical care. In contrast to those with lower education levels may struggles with these aspects. Next one, what are the health consequences of a lack of affordable housing? When people cannot afford good housing, they may live in crowded or unsafe conditions. Homelessness increases the risk of diseases, stress, and mental health problems. Poor housing can too lead to exposure to pollutions or unsafe drinking water, which harm overall health. Next one, how do crime and safety concerns affect health and wellness? High crime rates in a community cause fear and stress among residents. People may avoid outdoor activities or socializing, leading to physical and mental health issues. Experiencing or witnessing crimes can also cause anxiety and depressions affecting long-term well-being. Next one is why is access to health care a major societal issue? If your community does not have enough hospitals, doctors, or healthcare center, people may struggle to get the medical help they needed. This can lead to worsening health conditions as diseases go untreated. Poor access to health care is especially a problem in rural and in low income areas. Next one, how does cultural diversity impact healthcare access? Communities with peoples from different cultural backgrounds may face challenges in healthcare. Some peoples may not speak the local language well, making it hard to understand doctor. Others may have cultural beliefs that affects how they seek medical treatment. Discriminations can also prevent certain groups from getting equal health care service. Next one, what challenges does an aged population pose to society? When there are more elderly peoples in a community, there is a higher demand for health care, senior housing, and caregiving service. Older adults may need more medical attention, which puts pressures on hospitals and families. Younger generations may also how to take care of aged parents, which can be financially and emotionally challenged. Then, how does mental health affect community well-being? Poor mental health can lead to problems like social isolation, substance abuse, and even suicide. People struggling with anxiety or depression may find it difficult to work, study, or interact with others. When people in a community suffers from mental health issue, it affects overall productivity and happiness. What are the effects of environmental pollution on health? Pollution from factories, cars, and waste can lead to breathing problems, heart disease, and other illness. Poor air and water quality can weaken the immune system, making people more vulnerable to disease. A polluted environment also reduces opportunities for outdoor activities, which are important for staying healthy. Next one, how does income level influence health outcomes? People with higher incomes can afford better health care and comfortable living conditions which contribute to good health. In contrast, lower income individuals may struggle to buy nutrition food, pay for medical treatments, or live in safe housing, increasing their risk of diseases. Then, why is physical activity important for health? Exercise keeps the body strong, help maintain a healthy weight, and reduce the risk of diseases like diabetes and heart problem. It also improves mental health by reducing stress and anxiety. People who are physically active tend to live longer and healthier life. Next one, how does substance abuse impact community health? Using tobacco, alcohol, or drugs harms both physical and mental health. These substances increase the risk of diseases such as lung cancer, liver damage, and heart problems. Addictions can also lead to unemployment, crime, and family problems affecting the overall well being of a community. Thank you, viewers. Thanks for watching this video.